You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, gum disease, new treatment options for people that are suffering with this problem. With us, we have an expert on the topic, periodontist Dr. Scott Manhart. Dr. Manhart, welcome to the program.
Thank you for having me, Randy.
Now, right off the bat, what are the symptoms of gum disease? How do you know if you have it?
Well, the symptoms of gum disease can be subtle. The primary one that we tell patients about is bleeding gums. There's no other part of your body that you would expect to just bleed spontaneously when cleaning, but a lot of people, just because of their experience, that has been accepted
Like bleeding
as normal.
when?
Bleeding when brushing particularly, but bleeding on biting into hard items.
What about flossing?
On flossing, that is true. Anytime you see blood on floss, that would be
But a
indicating
little bit of
that there's
blood when you floss can be normal, right? Or it's okay?
No, it's not.
Okay.
Because you have to remember that the disease is actually deeper than you can floss. So if you're getting a little blood on the floss, you're just touching the very top of the area. What's underneath where you can't reach is actually a lot more severe.
Okay. So the fact that it's bleeding, you have a what?
It's
like an infection?
There's an infection.
All
yes.
right. So what are other symptoms of gum disease?
Occasionally patients will tell us that their gums will swell for short periods of time, not producing a significant amount of pain, but on occasion, they'll notice a particular area that might bother them from time to time. Receding gums. If the bone is where it's supposed to be, the soft tissue will be where it's supposed to be. If you're starting to see that change, if you're seeing a little bit more tooth than you normally have seen in the past, that would indicate that the bone is actually being destroyed and the soft tissue is following. Bad breath, obviously an infection in the mouth being produced by not the nicest bacteria is going to produce some compounds that are going to contribute to persistent bad breath. So if you've taken steps, if you've noticed bad breath or your spouse or significant other has told you that you have a bad breath problem and you have taken some basic steps to handle it,
and it's still not going away.
It's still not going away. The problem is elsewhere.
So it's like a bacterial infection under the gum line.
Correct.
Is that right?
Yes.
So loose teeth.
Loose teeth.
If you have loose teeth, chances are you have it?
If you have loose teeth, you've definitely gone further down the road that we would like to catch you at initially. But that would be a terminal warning sign that you're having a problem.
Now, people don't like going to the dentist, right? Especially a periodontist.
Absolutely.
I mean, you're in big trouble by the time they get to you.
Absolutely. We hear that every day. Every day.
So what do you do? So as a periodontist, your specialty, like, what's a day like? I mean, who's your typical patient, and what are the different type of dental problems you take care of?
Our typical patients are adults, say over the age of 35, as far as the periodontal disease patient is concerned. We also see patients coming from orthodontists and general dentists for soft tissue grafting procedures where they don't have enough gum tissue and we're having to add more tissue in. Then we also have the other problem where patients are coming out of braces and have too much tissue and they have a very gummy smile and their teeth look short. Those are fun surgeries.
So everybody, you laser those?
We do a combination depending on how much tissue is involved. If it's a lot of tissue, we'll use a combination of conventional and laser. If it's not that bad, we'll use the laser alone.
Okay. And gum recession, you deal
a lot of gum recession,
with that.
yes. Yes.
Is that just from brushing too hard?
No. It can be a contributor, but the primary issue is the anatomy of the bone and the teeth behind it. That's the reason why a lot of these patients had to have their orthodontic treatment to begin with, and we're dealing still with some of the things that are left over from that. Another big part of my practice is dental implants for patients who have experienced dental or periodontal disease to the point where their teeth can no longer be maintained, and now we have to place dental implants and work with their general dentist to get them back into a functional dentition.
So gum disease is a big problem. You know, when I think of Montana, I think of a lot of healthy people, outdoors.
That is true.
So gum disease is a big problem there.
It is a big problem everywhere, Randy. The last data tells us that over half of adults over 35 years old experience at least a moderate to severe amount of the problem. That gets up to even 3/4 of adults over age 65. So we're all subject to this at some point in time in our lives.
So there's two ways to get rid of this bacterial infection in your mouth, right? And it's the number one way you lose teeth.
Correct.
Okay. So there's and I think you told me, like, to cut it out, or to go around the mouth with a laser and kill the bacterial infection.
Correct.
Is that an oversimplification, or
it is
some truth to that?
There is a lot of truth in that.
Okay.
Up until just a few years ago, there was only one way, in fact, to deal with this, which was to go through conventional surgery, which is basically to cut it out. Fortunately, there's been some advances in the last 15 years that have produced a better way, a more effective way to deal with the bacteria and not remove as much tissue as we used to do, which leaves patients in a much better situation long term.
So if somebody in the old days, and how long have you been using the laser, by the way?
Laser we've been using for over a year now.
Okay, as a periodontist, so the old days, somebody had a periodontal disease, and you do what they call pocket reduction surgery.
Correct.
You would go in and do what in the old days in your practice?
We would take a scalpel and make an incision. We would lift the tissue away from the teeth and bone, so we're looking at the bone. We would clean the root surfaces. We would clean out any infection-related tissue that was still present, place bone grafts, membranes, whatever it took to try to get the bone to recover a little bit, and then we would put the tissue back at a much lower position, exposing a significant amount of the root structure, which is sensitive. It's subject to tooth decay later on. It creates a lot of problems for patients with eating and cleaning. It wasn't wonderful. What patients used to tell me, particularly following the surgery, a lot of pain, a lot of swelling, occasionally persistent bleeding problems that might go on for several days afterwards, occasionally even post-operative infections that would require multiple courses of antibiotics. That, for the most part, has been eliminated with this new technology.
With the laser?
Correct.
So how does it work? Okay, so there's a bacterial infection.
Yes.
And what does the laser do?
The laser actually is accomplishing the same sort of things that our old therapy did, but just doing it in a smaller space with less insult to the patient. Consequently, they heal better. Now, we do know now, because of a research that was just recently released, that the laser is in fact the only way that we have to actually destroy the bacteria and get you back to get a patient back to a pre-disease state. Our mechanical methods did okay, but they could not eliminate the
Mechanical
offending bacteria.
Surgery.
Surgery.
Cutting
Mechanically
the gums.
cutting the gums.
And that's painful.
It is
I
painful.
mean, you said that you couldn't even get, you would do one side of the mouth, couldn't even get people back in to do the other side of the
Patients
mouth.
oftentimes,
in the old days.
in the old days, we would have a lot of half-mouth wonders.
So there is scientific data that this is effective.
Absolutely. I think that people who are still resistant to adopting are waiting for
People
more,
meaning who? Other dentists?
other dentists and periodontists. And I think that we're at the point where you just can't say that anymore. The data is good. All I can tell is add it to your practice and you'll see it will revolutionize.
Is this true, though? I think you told me that it can be less expensive
Absolutely.
and more effective than the traditional surgery.
Absolutely. It can be less expensive for many patients, because when we were doing conventional surgery, we were having to bring in other items like growth factors and bone grafts and membranes to try to help the bone to recover. In the case of using the laser, what we're doing is harnessing your body's ability to heal and turning it in our favor so we don't have to use that off-the-shelf stuff.
You brought a video.
Yes,
of
I did.
how the laser works. It's animation.
Exactly.
What can
yes.
you tell us about this video?
Well, this depicts the process that we go through to clean the periodontal pocket and to set it up for healing.
And the pocket is what? It's the tissue, it's the gums around the tooth.
It's the space between the gum tissue and the tooth that has been produced by the bone being destroyed by the bacterial action. Okay. And so what the laser will do is it enters the pocket, it removes the tissue that's associated with the infection that is contaminated, at the same time not damaging the adjacent tissue, so that when we're done, it is ready to jump into the healing process.
I mean, do you have patients that had, their whole life, their identity was, I have bad gums, and now they have good gums?
Yes.
Really?
Absolutely. Absolutely. We have some patients who started fighting this disease in their 20s, and those were always difficult, given how long that we would have to manage them. And the gains that they can make with this approach is remarkable. I have one patient who was 20, actually was at risk for losing about 5 teeth to a periodontal infection, which is highly unusual at that age, but it does happen. Had been advised that she would probably have to have dental implants and significant amounts of restorative dental work and crowns and bridges. We brought her in. Went through the laser therapy. 1 year later, the teeth are stable. On the x-rays, we see the bone growing back. She has no sensitivity. And most importantly, as a 20-year-old, she doesn't have root structure exposure, so she's going to be able to go further in her life without incurring the problems that comes with that.
Interesting. Now, in Billings,
Yes.
would you say that these pocket reduction surgeries to remove the gum disease are happening every single day?
Absolutely.
Okay. And would you say, and I don't want to put words in your mouth, but the public doesn't know their options? They don't know about the laser?
Right now, they don't know about the laser, and that's the reason why my office and myself have been very active in trying to get this word out, because it's going to become the mainstay of periodontal therapy in the future.
So people may not lose their teeth in the future if they get it done early enough?
If they get it done early enough, that's the key. We can still do some amazing things with advanced cases, but just as with any disease, the earlier we get it, the less therapy we have to do and the better the result for the patient.
So on your website, or researching this interview, you guys have these buttons.
Yes, yeah. Let me tell you about them.
Okay.
The buttons, they say no cut, no sew.
Yeah, what does that mean?
That means that we don't use scalpels like we used to anymore. And the vast majority of patients, we don't have to stitch the tissue back together like we used to after we had laid it away from the bone and the roots. That's one of the primary advantages for the laser therapy, is that because we don't injure the tissue as much doing the therapy, it is in a much better position to heal naturally without us doing any more.
Now, we brought the video. So we're going to go to the video.
Okay.
This is a video that gives you an example of what you do with the laser.
Yes.
Okay, let's take a look.
The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periodontal laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
That looks pretty easy.
Okay.
But is that pretty accurate, by the way?
It's accurate schematically. It actually does take quite a bit of time to do this. It's not any faster than conventional surgery, and in sometimes it takes even a little bit longer. But it is far more comfortable for the patient to go through.
I mean, you've gone through a lot of training when
Yes.
it comes to, in fact, weren't you there yesterday or
Yeah,
something like
I was
that?
there on Saturday.
In California?
Yes, yes.
And what are they teaching you that you already don't know, right?
One of the things that the companies very emphasizes is they want to make sure their practitioners are effective and safe. This is a dramatic departure from how periodontists were trained in their residency. And so it's not something you can just hand to someone and say, just go and take it into your office and use it.
Well, the video looks easy. Like I could go in there and go around the mouth and kill it.
As most things, it's going to be a little harder than that. But that is the emphasis behind that, and the coursework that they have you do, which includes hands-on treating of patients with experienced clinicians, is to make sure that they can address any weaknesses or any areas that you may not be up to speed on yet, to make sure that you can accomplish the surgical goals you're going after and yet be safe and not induce any unnecessary damage to the patient.
Now, and this is a little bit of a different topic, but I was speaking to a periodontist here in San Diego. she uses this Lynette Protocol, this laser.
Yes.
She says people that we used to extract teeth, no longer, we're not extracting teeth on many of these patients. She says some patients that she herself thought this tooth is gone. She goes, but we did it just as an experiment, offered the option, and the tooth. Are you seeing this kind of thing too?
I have had a patient who was told that she, at 35, had to extract essentially all of her teeth and go to implants. Needless to say, it was a bit of a shock to her, and she went looking for alternatives.
How'd she find you? Like a laser search or something?
She found me through conventional, through her general dentist, looking for alternatives because he didn't like that option for her either at that age. And then through an internet search, looking for options. Even when she came in, and even with my training on the laser, this was a situation that I thought, this is not going to work. We may be able to hold her together for a short period of time.
So she was told all of her teeth have to be pulled out?
Right.
Okay.
Right.
So you did the laser?
So, but she was insistent she wanted to try. And she had a couple of teeth that I had anticipated would fail. We stabilized them a little bit so they wouldn't hurt when she bit on them because they were so loose. Our plan was to take them out, but like sometimes happens with patients, they don't always follow through with those recommendations. 8 months later, she came back to my office.
So you lasered her?
So we lasered her. 8 months later, she came back to the office, and two of these teeth that we had planned to take out suddenly had developed 50% bone support around them, and they were essentially out of the bone when we saw her originally. And so now we're not planning on taking those teeth out, and that was a big wake-up moment for me because regardless of
this laser really works.
Because regardless of the training, you always have the voice in the back of your head saying, no, this is too good to be true. And when you see those sort of results, it really makes you think twice about what you've been doing for the last 25 years.
So no more cutting or sewing, and no more stitching.
Correct.
So you're a firm believer in the laser. What if somebody has been scheduled for gum surgery elsewhere? Do you say get a second opinion?
I would say get a second opinion at this point, because we know, because of the inability to eradicate the bacteria that are causing the problem with conventional therapy, and that, as I said, was just shown definitively just in the last month or so. We really do have a dichotomy, and when I go home, I'm going to have to sit down with my office staff and say, we may have to change what we're telling our patients, because we now have a study that says...
A published study. You brought that.
Yes, I did, yes.
It's complicated to me. But summing it up, it's basically saying that this works now.
Summing it up, it says the laser approach can eliminate the causative bacteria of this problem, whereas the conventional therapy that we've been doing for the last however many decades can suppress them, but it doesn't get rid of them.
Okay. So the way dentistry, I mean, and we've talked quite a bit,
Yes.
and you've helped me understand a few things, but it's a bacterial infection. That's why people lose their...
Correct.
And as we've said throughout the show, so if you have bleeding gums, bad breath, puffy red gums, loose teeth,
yes.
You probably have this bacterial infection. 2 ways to get rid of it. Cut it out.
Right.
Or a combination of cutting and deep cleaning. Or you can go around the mouth with a laser.
Yes.
And this laser targets this bacteria. Is that right?
It targets the bacteria that are most responsible for the disease.
And then it stimulates what? The bone?
It stimulates, it has some interesting effects on the cells next to the area that we have worked in. It actually stimulates them to form new bone and new ligament attachment to the root, which is true periodontal regeneration. And that was one of the questions for many years. But even that data is now coming in and is undeniable that it's happening.
So how soon can the bleeding gums, bad breath, loose teeth go away? Like, what are some of your best?
A week or two.
Is that right?
Week or two. I have one patient who, bless her heart, she has been fighting this disease since 1988. And she's gone through conventional surgical therapy twice. She got to the point where she couldn't eat or chew. She was having to basically live off of a blender type diet. And her condition was so severe that I really had no alternatives. If I tried to do conventional surgery again, her teeth would have fallen out at that point. And again, in a last-ditch effort, we went ahead and did the laser therapy on her. And she visually looked like she was healing fine and she didn't have any complaints. But 3 weeks after we did the laser, she came in for a post-op visit and we were talking, and she said, the most amazing thing is I am now eating things that I have not eaten for 10 years. That was stunning.
Is she a lot of people, by the way? I mean, is that common? Would you say that there's thousands, maybe tens of thousands
Yes.
of people that are avoiding certain foods because they can't eat them?
Correct.
That they, with maybe a few visits to your office, going around the mouth with a laser, their teeth will get stronger and they can start eating and chewing again.
Absolutely.
So then why aren't they all doing it?
Because they don't know their options. That's one of the reasons why we're doing this show today, is to be able to get the word out to as many people that they don't have to live in fear, the fear that has been keeping them away from getting this disease treated.
Now, insurance.
Yes.
If insurance covers the surgical procedure,
Yes.
does insurance cover this procedure?
Yes.
Interesting.
Yes.
And do you believe it's more effective? I mean, you're a periodontist.
What I can tell you is
What do you think?
in the last year, I have done things, been able to maintain teeth that I had no hope of maintaining with conventional therapy.
Maintaining meaning?
Keeping, in function,
Okay.
pain-free,
Interesting.
saving patients from having to go either to removable dentures or into the implant type therapies.
Do they need a referral to see you?
No,
Or
they
could
don't.
They could call you directly.
They can call us direct. They can call us direct. If they don't have a relationship with a general dentist at this point, they can just call my office and we will arrange
We're
to see
just
them.
about out of time. And dentists will watch this show. What do you want them to know about this laser? Because you're the only, as of today's date, taping date, you're the only periodontist with this laser in Billings.
Correct.
So what do you want them to know about your laser?
If you have patients who have bone loss, bleeding gums, deep pockets, patients who you've referred previously but will not go, that are concerned regarding fears regarding surgery, there is no reason to fear periodontal therapy at this point. Once we do the therapy with the laser and we get them back to the general dentist's office for their routine maintenance, the hygiene team's going to find that they are far easier to take care of.
Okay.
There's far less sensitivity. There's far fewer sites that are continuing to have problems, because this is a chronic disease. It does have occasional flare-ups down the road, but now those are easy to manage as opposed to what we've been doing for the last several decades.
Okay, now you brought a comparison here.
Yeah.
Is that the laser tip, or what is that?
This is just to show you the difference. This is a typical instrument that we would use in periodontal surgery.
Okay.
As you can see, it's metal. It's pretty big. This is the tip that we use for the laser.
You can hardly see it.
You can hardly see it. It's flexible, so it can get around corners. It can simply get into places that this cannot
So
get.
you just kind of poke that below the gum line?
What we do is take the laser while it is firing around the top of the tissue to remove the inflamed and infected gum tissue. And then once we've cleaned out the infected tissue, we go to the depth of the pocket, which is going to kill the offending organisms and, in effect, sterilize the area. And then on a second pass, what we will do is then engineer a blood clot, because blood clots are what our body uses to heal. But we want a specific blood clot, and as we withdraw, we are setting that blood clot in place, and that's going to become the regenerative membrane that the body is going to use to reconstruct the bone and the attachment to the tooth.
Good, good. So you love this procedure?
And
it's changed your whole life as a periodontist?
It has changed my entire practice as a periodontist. A colleague of mine who put it best, he said, when I was doing conventional surgery, he said, I didn't like going to my office. It was a high-stress office because what we did was not pleasant and patients knew it. He brought this in and he said, it's a happy place. Patients love it, staff loves it, and moreover and more importantly, it's better than what we were doing.
Is that right? I mean,
Yes.
do you get a sense of where you like your career again?
Oh,
Or you
absolutely.
Like you like it more now than...
Absolutely, because selling conventional surgery to patients, sorry to use the term selling, but that's what it had to be.
Like they didn't want to do it.
They did not want to do this.
So you almost had to feel pushy to get them to do it.
Exactly. Even though their systemic health is going to improve by taking care of this infection, because we know that untreated, millions of bacteria are getting in your bloodstream every day, and they're damaging hearts, blood vessels.
Which is another topic, right?
A whole nother topic.
Because you say with bleeding gums, all the bad bugs, bad bacteria is going into your bloodstream.
Yes. Yes.
We haven't even mentioned your background. I mean, you know a thing or two about immunology.
Yes.
I mean, you won an award, I think.
Yeah, yes. During my residency, I did research on periodontal immunology, particularly what are called T helper cell subsets, working at both University of Nebraska and at University of Queensland in Australia.
So there's a lot of health benefits. We'll have to have you back on the show to talk about those, but there's
That'd
a lot
be
of
wonderful.
health benefits as well.
Yes, that's
because you're killing an infection.
We are killing the most common infection that people walk around with and don't know they have.
Interesting. You said people may even get more energy.
Yes.
How?
Well, it's just if one thinks about it, when you start getting the flu, the first signs are not coughing or runny nose. The first signs is you simply don't feel like getting up. You're just run down.
Okay, good point.
Many patients come back after having their periodontal disease treated, and that is the comment they'll make. I didn't realize how run down I was, how little energy I had, until I had this treated.
That's good. So this is cutting edge stuff.
Absolutely. It's going to be mainstream. I would predict that within 10 years, it will be mainstream periodontal therapy.
Now, in the world of periodontics, and you guys are the gum specialists,
Yes.
right? You're the recognized experts. It's still divided? About 50% are using the laser and 50% aren't? Or
it's about 30-70 right now, but it's ramping up dramatically.
So if you're going to get, if you have bleeding gums, bad breath, puffy red gums, loose teeth, or you've been told you need an extraction, maybe get a second opinion.
Get a second opinion.
Go in, and how soon on that consult can you tell them with somewhat certainty, we think you'd be a good candidate?
Within 15 minutes.
15 minutes. All right, good. I want to thank you for coming on the show.
Well, thank you for having me.
Final
Randy.
message
I really
to somebody that has the symptoms we've talked about. What do you say to them?
Don't ignore them. There is more at risk with this disease than just loss of teeth. We have to start changing the way we think about dental disease. It's not. It's simply disease, and it has full body effects, and we need to deal with it.
Okay, good. Well, thank you for coming to the show.
Thank you, Randy.
Good job. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. I wish you good health.